Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And you can always find Let's Talk Micro on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Pandora, TuneIn Radio, GoodPods. Whatever you listen to podcasts, you can find Let's Talk Micro. As far as social media, I am on Instagram, TikTok, and YouTube as Let's Talk Micro, Twitter as Let's Talk Micro 1, and on LinkedIn as Luis Plaza. So please go ahead and subscribe to the podcast, download episodes, and leave a review if the app allows you to do so. And as always, thank you for the support. So please continue downloading episodes. And if you have any feedback, any suggestions, you can always submit those via social media, or you can email me at letstalkmicro@outlook.com. So any feedback, any suggestions, they're always welcome and appreciated. And on social media, I like to post pictures of organisms and give updates as to when the next episode is coming out. And if you haven't checked out the previous episode, please go ahead and do so. As I had as a guest Dr. Melissa Jamerson from Virginia Commonwealth University. And she came to the podcast to talk about the MLS program they have, which they have different options. They have undergraduate options, a bachelor's for medical laboratory sciences, and they also have several options for a master's degree, including an upcoming one this fall, which is with a concentration in public health laboratory. So ultimately, that master's degree, it will make you a better fit to work in a public health laboratory setting. So if you haven't checked it out, definitely please go ahead and do so and find out what those options are. But overall, VCU has both undergraduate and graduate options. So today's episode is a collaboration episode, and it's between Let's Talk Micro and the Microbe Mail podcast. So the credit goes to Microbe Mail podcast, the host Vindana, and this is the podcast, about microbiology. They go over diseases, they talk about organisms. If you haven't checked it out, definitely please go ahead and do so, and I'll give you the link on the show notes. But the idea was from Vindana, who's a microbiologist in South Africa, and that's where actually the podcast it's from. So it was definitely, it was a great idea. And in the episode, we talked about yeast in cultures. So we go over, yeast that we typically see in the lab. We talked about media, we talked about antifungals, what kind of instrumentation we use, to identify yeast. We talked about sources, where yeast will be considered clinically significant versus other sources where it be considered more of a flora, So definitely it's a very informative episode, very educational. I had a great time. I kind of talk to Vindana via social media every now and then. I have listened to her podcast. I have listened to episodes. So definitely very grateful to have the opportunity to be in her podcast and talk to her about yeast and cultures. So I hope you enjoy it. This episode is also published in her podcast, and it's going to be published here on Let's Talk Micro. So definitely, once again, I hope you learn about yeast. I hope you enjoy it. And thank you, Vindana, for giving me the opportunity. So let's go ahead and listen to it.
Hey waiter, there's a fly in my soup is possibly one of the oldest jokes with hundreds of variations to it. Not quite as funny as when a clinician calls the laboratory and announces, "Hey micro, there's a yeast in my culture." But now, as with the fly joke, there are a number of varieties of yeast genera and species, and its significance in different specimens may also vary. So today's episode of Microbe Mail and Let's Talk Micro is focused on the different yeasts and how they are identified in various specimens. So this is Microbe Mail, and I am your host, Vindana Chibabai. But we've got a special guest today. And before I introduce my guest, you may have noticed that my voice doesn't quite sound as it normally does. I've been down with an upper respiratory tract infection these last few days and haven't really managed to kick it yet. I'm so super excited to be hosting a fellow microbiology podcaster from all the way across the Atlantic Ocean. Luis Plaza is the host of the podcast Let's Talk Micro. Luis, welcome to Microbe Mail. And please tell our listeners a little bit about yourself as well as a little bit about your show.
Well, definitely, thank you. It's a pleasure to be here. Thank you, Vindana, for having me. It's great. Finally, nice to meet you and be, talking to you. I've been doing this for 2 years. I posted recently and I seen your podcast around and we have talked. I listened to your episodes. So it's great to be doing this. So definitely thank you for taking the time, especially when you're a little bit under the weather. So I hope you pull through this and feel better. So for the listeners out there, yeah, my name is Luis Plaza. I have a podcast called Let's Talk Micro. I'm a medical laboratory scientist in microbiology, other parts of the world. It's called a biomedical scientist. And we just, we work with samples in the clinical laboratory. And then, we plate them, we do cultures, we find out basically if there's an organism that's causing that disease, and we test for susceptibilities if indicated. I started this with the goal of sharing information. I'm also learning myself, over my career. Sometimes I experience a little bit of roadblocks when it comes to learning. And so basically what I want to do is, okay, I learned this either by researching or talking to someone, and I'm going to put it on this platform. So you can go ahead and learn also yourself. It will make us better in our jobs. And also you put it in a format that is just easy to listen. You can be doing anything, right? Any chores like laundry, cooking, and then a 20, 30-minute episode. And you get, some good information.
Absolutely. I completely agree with you. So yours was a pandemic baby. Let's Talk Micro.
It actually, yes. I will say, well, I started in May of 2021. So it was a year after everything hit. But I had the idea for a while. It was just sometimes, the getting around to it.
Yes.
Doing the research, and then maybe sometimes, I Google how to start a podcast, and maybe you're busy and it's like, okay, it looks a little difficult. But once I took the time, it's not difficult. It's just, it's a little bit time consuming. So you have to be committed to doing it.
Yes.
But overall, it was great. At the time, I was kind of, work between two different jobs, and it was also a way to continue reinforcing the knowledge.
Yes.
So I started it and then just very happy and continue doing it. Like I said, when I introduced myself 2 years later.
And you're doing a great job of it. I thoroughly enjoy listening to your episodes as well. So before we head into this episode, just a couple of reminders for our listeners. Remember to sign up for updates on the Microbe Mail website. You can subscribe to both the shows on your favorite podcast player. If you haven't yet rated Microbe Mail or Let's Talk Micro on your pod player of choice yet, please go ahead and do so. And follow both the shows on social media. I know Let's Talk Micro is on Instagram as well as on Twitter. Microbe Mail is on Twitter, Facebook, and Instagram as well. And you can contact both Microbe Mail and Let's Talk Micro on the email addresses provided in the show notes. And last but not least, please share Microbe Mail and Let's Talk Micro with your friends, colleagues, co-workers, and students. Okay, Luis, you ready to talk about yeasts in culture?
Yes, I am.
Awesome. So first question, can you tell us in which scenarios or clinical specimens the laboratory would try and culture yeasts?
Well, in the laboratory, typically we try to culture yeast in samples they include, sterile body fluids, or samples that are product from a surgical intervention. So are sites that are normally sterile in nature.
Mm-hmm.
So, the way here that we do it typically, so you get your bacterial culture, but a lot of the yeast that we'll be talking about, like Candida, they definitely grow in your regular blood, chocolate, and even McConkey agar.
Mm-hmm.
So you will see some of those when you're working the cultures. And in addition to that, they order, if they're looking for a yeast, so they will order a fungal culture with a little more specialized media to help detect those. But like I mentioned, some of these, if you're working on a hospital, and even if you don't have a mycology department, so you just basically stick to bacterial cultures, they will grow on your media. So you need to be familiar with them. That way, you can properly identify them.
So that's quite an important point that you make there, that it's going to grow even if you haven't specifically requested fungal culture. But in those little scenarios here and there where it's not that easy to grow, it's useful to let the laboratory know that you're suspecting fungi so that they can add the additional media. Just out of interest, what additional media do your laboratories use? So in our laboratories here in South Africa, we usually have access to Sabouraud dextrose agar. That's our typical yeast agar. What do you use on your side?
Yes, we know we definitely have that one. And then we have Candida agar, which is like a chrome agar.
Right.
So I have talked about that before in my episodes. So just to put it very simple for if you're a student or you're not too familiar with it, just basically, it's an agar. You put your sample there, or you can sub your organism, and then it reacts with the medium, and you will get a color. So that's very popular with especially when we are in the cultures that I mentioned, that if we're suspecting a yeast, or we're looking at that initial gram stain and we see, okay, 2+ yeast was seen, but all I'm seeing is just maybe this gram negative, this gram positive organisms. So we'll go ahead and grab that Candida agar and grab the original sample and subculture it to it,
Right.
to see if we can actually retrieve that agent. But we also have a Sabouraud dextrose, a Sabdex, that also has a brain heart infusion
Yes.
with it.
Right.
So those are the ones that we use.
Okay, great. So fairly similar. There's some private laboratories in South Africa that are using the chrome agar. And we recently evaluated it in our laboratory. You need to have a pretty good sense of color detection for some of the yeasts to identify the different ones. It probably comes with experience.
Oh, so up until now, it wasn't used in your laboratory?
The chrome agar? No, we didn't
Mhm.
have access to it until very recently.
Okay, yeah. Now that we're talking about this, it's always interesting when you talk to microbiologists from other parts, of different parts of the world or areas. Like you always see, right? Sometimes, we have this stuff and then we think that maybe everyone uses them.
That's true.
And as you talk and we become aware, okay, it's something that not everyone does. But that's good. I think it's very helpful, and some yeast, like Candida glabrata, like if you have it on a blood agar, it grows small, it grows like a more pinpoint, but you put it on the Candida agar and it definitely grows stronger.
True.
So it will help you on if you're using an identification method where you need a suspension or like a very heavy suspension, a heavy McFarland standard. So it will help you, if you don't have Molotov. So it's definitely very helpful in those cases.
Absolutely. Yeah, I agree with you. So then this concept of there's a fly in my soup came up because often we'll get yeasts growing in clinical specimens. And in many cases, there are either contaminants or colonizers. And we'll get a panicked clinician picking up the phone and saying, but there's a yeast and there's a candida that's growing in the specimen. Oh my goodness, what should I do? And that's really what sparked the idea for this episode. So can you tell us which yeast or which specimens you would consider a yeast to be a contaminant or a colonizer, or not necessarily all that significant?
Well, definitely, samples from a respiratory nature. When we have sputums or so those, and I know that sometimes it causes a little bit of hesitance with the text because you're seeing something growing on your plate, and then you're trained, especially like right, you're thinking body fluid, you're thinking blood, which is also another one from blood cultures. So you're thinking, okay, I'm seeing something grow on this plate, and I'm letting it go as normal flora. So in sites like that, but then when it comes to like patients from cystic fibrosis, we do work those up. But in just regular sputum samples, we just it will get released as oropharyngeal flora. And even from the gram stain standpoint, if you're seeing yeast and samples like that, it just gets reported as oropharyngeal flora present or seen.
Yes, and in fact, that's the one situation where clinicians often phone in a panic state. It's a sputum specimen. Is it a candida pneumonia? So true. It's generally a colonizer contaminant from the upper respiratory tract during collection of the specimen, in fact.
Yes, and sometimes it makes it, and I can see it's also with the physician because, and we'll talk a little bit more about this, but sometimes, depending on what kind of instrumentation you have, when it comes to identifying the yeast, the lab is not even able to identify it. It might have to be sent out to another place.
Right.
So a physician also can, okay, I'm not seeing an ID. I saw maybe something was seen on the gram stain. So what is it? And
What
then
is it?
the delay where you're sending it out to get tested, to get identified. So yeah, I can see that scenario.
Yeah, absolutely. So, what are the common yeasts that one would isolate in a clinical specimen? And can you tell us a little bit about each of these genera?
Yes, certainly. So definitely, Candida. That's just the one that you will see the most in all your samples, and you will encounter from those that like from the blood, the body fluids that I mentioned. But definitely overall, you will see it on a lot of types of of wound cultures. You will see it in urine samples as well. So very classic morphology, right? So we said little, we call it the feet, right? So very classic. Typically, some places will presumptively identify it based on that. Um, so that one you will definitely see it a lot. It's very common, and of course, just you can see it in like the thrush, which is an infection of the mucous membranes of the mouth. Another one that you can see is Candida tropicalis, definitely. Candida glabrata, which I mentioned,
Mm-hmm.
and you can see that one in urinary tract infections, and also parapsilosis, which that you can also see it there, and all those they grow definitely very well on your chrome agar that I mentioned. Depending on which manufacturer you have, typically like on the one that we have, which is the Cab2 agar, your Candida albicans is blue, your Tropicalis is pink,
Right.
Parapsilosis is just white. You can also see so albicans, Tropicalis, glabrata, Parapsilosis. Overall, Candida, you can see it in fungemia, UTIs, and endocarditis. And other times you can see it in meningitis. And of course, to a lesser extent with the Candida genera, but you can see Candida auris, which is definitely, as we will say, trending in media.
Yep.
And then we also have, Cryptococcus, definitely, Cryptococcus neoformans,
Mm-hmm.
right? A big player in meningitis. So I've seen immunocompromised patients. For the techs out there, biomedical scientists, medical lab scientists, it tends to be mucoid. So it's a slow grower. So if you have that CSF, that CSF culture, you're working on your regular, culture, it was seen in the gram stain. It can take up to 3 days to grow. And then, we have malassezia, a little bit less common, but it can be seen in dermatological diseases.
Mm-hmm.
And that one to keep in mind, it grows with lipids. So if you're learning about it, sometimes, with the Molotov, we had a very weak colonies that we can set it up and identify
Mm-hmm.
it. But then, if you add that layer of olive oil, it will grow much stronger.
Mm.
And then we have Rhodotorula, the orange red colonies, Trichosporum, and Saccharomyces, which is an emerging pathogen. Definitely seen in fungal blood infections
Yes.
with risk factors. Immunosuppressed, ICU patients, central catheters.
Yeah. Yeah. So I think we kind of see very similar pathogens on your side and ours. Definitely Candida auris trending has become the second most common cause of candidemia in South Africa. So very, very common. And then I'm sure you know that Cryptococcus neoformans is, as you say, a huge player in meningitis, especially in sub-Saharan Africa. So yeah, absolutely. We see a lot of it. Good point about it being a slow grower. So don't throw out your cultures too soon, particularly from a CSF.
Yeah, and something very interesting with Cryptococcus that we do very popular where we do like an antigen test. So sometimes, the techs, they might not like it because if you get a positive, you have to do a titer and that's time consuming. And the way that, we like to say the planets align and life happens, you get this at the end of your shift. So it's like, oh, let me run this candidate, this Cryptococcus real quick. And typically they're negative, and then all of a sudden, here you go, an extra 15 minutes or whatever, just doing
Just doing the
the
teeters.
dilution. But yeah, people don't like it in the lab. Yeah.
No, that's true. Okay, so I'm so interested to hear from you, Luis, about what are the common methods that you use to identify yeasts that have been cultured in clinical specimens. So you've already talked a little bit about the chrome agar. You've briefly touched on the moldy tough, but I'm really excited to hear what you have access to, whether you have access to things like molecular diagnostics, etc., compared to what we might have here in South Africa.
Yes, so definitely for blood cultures. So we have this is from we have the Eplex BCID FP panel, and I don't know. Typically, if I mention a test or a sample, right, I always like to check the audience. Where it's not like those companies, they're not sponsoring us. Just I'm mentioning the test and I'm talking about it. So a little disclaimer, but so that one, the Eplex, and it can actually, I wrote down the ones that it can identify. So it can do Candida albicans, Oris, Dublinensis, Fomata glabrata, Giramundi, Kefir, Krusei lustani parapsilosis, Cryptococcus gattii, Neoformans, Fusarium, and Rotorula.
Wow, that's an extensive panel. Is this a molecular test, the Eplex?
Yes, it's a PCR. So it's very easy to set up. Once you have either your fungal blood culture bottle, or like I mentioned before, this will flag on your regular blood culture bottles. For the audience out there, you have that set where you have the aerobic, anaerobic. So once your system is positive, you do a gram stain, you see that yeast. We go ahead and set it up on this panel. Very easy to set up. We just get an aliquot, and it's like a little cassette. So we just put an amount there, put it there, and I think it's less than 2 hours that you get an actual result.
That's amazing. So directly from the positive bottle, you don't even need to wait for a culture.
No, we just go ahead and Nowadays, with the supply shortages that we experience, every now and then we might encounter roadblocks where maybe we don't get enough or they're on back order. But when we do have enough on hand, there's it's always really good and very convenient to have it.
Absolutely.
Yeah, that's the system. Before we used to do the Luminex, but now we're just been using this GenMark. So that's when it comes to that. And then when it comes to now, it's growing on the plate, and you're gonna do an ID. So we actually, we have the Vitek yeast card.
Yes.
And then very definitely very popular. And then we also have the Vitek MS.
Okay. So you would start with your Eplex and then follow that up with the yeast, either the Vitek MS or the Vitek yeast card. That's the two options.
Yes, correct. So once we get the plates, like especially our lab is very large. So you have two sections. So the section where they're reading the blood cultures and they do the initial plating, plate setup, where in this case, if you see a yeast, our standard setup is normally, you have your blood chocolate MAC, and then we add the Candida agar plate.
Okay.
So once, it gets to the bench where it is read, then we see the organism, and then we confirm the ID based on so we use typically mostly the MS.
Right.
So right now with us having the MS, the yeast card is more of a backup.
So it's very similar in our setting. So we don't have the Eplex, so we don't have any molecular diagnostic tool available. So once we've got yeast on a blood culture bottle, we'll wait for growth. As soon as we've got growth, we'll put it up on the Vitek MS. And if it fails on the Vitek MS, as you say, very similarly, we'd put it up on a yeast card on the Vitek as a backup. So quite similar, except that you've got very exciting multiplex PCR available. And it sounds like quite an extensive panel, which is really great.
It is in this lab. I worked before with it's definitely out of the ones that are there, I believe it definitely has quite a bit of targets.
Yeah.
So, but we just then after that with the MS, and which has typically it has an extra step where you add the formic acid and then put the colonies there. So that's one of the things that you have to make sure when you're working these organisms, don't forget to add the matrix.
Absolutely.
So if you're stepping away, leave a note, and that's how we typically do it. We start our yeast first, and then if they haven't dried yet, we leave a note saying go ahead and add the matrix.
Yeah.
That way, if it fails, it's not because of an user error.
Yeah. And also you've got to emulsify quite carefully when you're doing yeast on the MS as well. Because if you're rushing, then you can get failed IDs.
Yes, definitely.
So then moving on to antifungal susceptibility testing, Luis, can you talk us through which samples you would perform susceptibility testing on, what drugs you would typically test for, and for which samples is it important to actually report the antifungal susceptibility test results, and which ones are not so important?
So definitely blood cultures. So those are the very important ones, blood cultures and body fluids, sterile body fluids.
Mm-hmm.
So those are, they're also considered critical results. So the moment that on the blood, when you detect someone, you make the phone call initially.
Yes.
So this is more of when you're working on the bench. So if you see that a yeast is actually growing on those type of sources, you will go ahead and make a phone call and follow your callback procedure where you document who you talk to.
Mm-hmm.
So those samples, either on the fungal culture with the fungal plates, or you're recovering it from your bacterial culture. Those you go ahead and do susceptibilities on them, and then we report them. So as of right now, we have two systems. We have the Vitec, the YS09 card.
Mm-hmm.
So we do susceptibilities. That one right now, with our volume and with the other method that I'm going to talk about in a minute. So it's also more of a backup. Or maybe if you have a request to do susceptibilities on sources that we normally don't do them on. So that one tests for caspofungin, fluconazole, fulcytosine, micafungin, and voriconazole.
Okay.
And then we do broth microdilution.
Okay.
And that one, so like I said, that's the most common one that we're using. And then that one is just, it has caspofungin, micafungin, anidolifungin, fluconazole, itraconazole, voriconazole, posaconazole, isovuconazole,
Wow.
amphotericin B, and fulcytosine.
This is manual broth microdilution in a routine lab.
Yes, correct. So the setup is actually fairly simple, right? So we originally make our suspension with the yeast broth, and then we transfer an amount, actually just make a suspension with water, and then we transfer to the yeast broth. And then we have an automated dispenser.
Okay.
So it will just release 100 microliters to each of the wells, including the control. And then it takes, we incubate it for 24 hours.
Mm.
And then we have to manually click on the MICs.
Yes.
And then we report those. But yeah, it definitely has a lot of drugs, and it's not really labor intensive. Yeah.
Yeah, that's an extensive list of antifungal agents that you're testing for. And you don't do the gradient strips or e-tests for any of the antifungals?
No, actually, no. Yeah, no. We're constantly, bringing new things and stuff.
Yes.
But as of right now, yeah, the broth microdilution we've been doing that for a couple of years, I believe. And it quickly transitioned, right, they put the Vitec card on the backup method. Sometimes, especially if our if we run out of sensitizers,
yes,
or things like that, then we use the Vitec card. And like I was telling the audience too, so typically you can have in the lab someone calls and then you report that you saw a yeast, and let's say in urine culture, and the physician calls and say, hey, I'm requesting, can I get susceptibilities on this, let's say Candida albicans, for example. And then in cases like that, that's when we go ahead and do the Vitec card.
Okay. So you get a more rapid result for them while you're waiting for the broth. Okay. That absolutely makes sense. So the difference on our side is that our first point of call would be the Vitec card. So I don't think we've got the YST09 yet. We're still on 08, but it's fairly similar, I think, to the 09. Just thinking about the antifungals you were mentioning now. Not very, very different. And then we don't have broth microdilution in our routine labs. So we've got fluconazole, voriconazole, mycofungin, and amphotericin e-tests that we use as a second line. And then if we do want broth microdilution, we send that off to the reference laboratory at the NICD, and they'll perform that for us. So yeah, I mean, we have access to similar things, just not necessarily all in the same lab.
Okay, so now I ask because I haven't worked with the e-test before, so they normally work very well. Like you get enough growth and everything works pretty well.
Yeah, they work fairly well. They're quite easy. Well, okay, I'm saying easy to read, but easy to read when you're experienced, especially with the azoles. Remember, because there you're looking for 80% inhibition and not 100% inhibition. So when you're reading mycofungin and amphotericin B, that's fairly easy because you're looking at 100% inhibition, but you really need to be quite careful and very experienced to properly read the azole e-tests, because you will get a little bit of growth even in the area of the ellipse, and you need to be able to differentiate between what is 80% growth versus what was 20% growth. Yeah, but once you've been trained and you've had a bit of experience reading them, then they're fairly decent. The growth on the plates is remarkably good, so that's not really a problem.
And I asked this because like I said, I haven't worked with them before. But so, what kind of what kind of agar do you use for when you're doing e-tests
We
on yeast?
use RPMI media. Now I've just completely hit a blank and I cannot for the life of me remember what the RP and M and the I actually stand for, but we use RPMI media, which is special media for antifungal susceptibility testing. I'm assuming it's similar to the broth that's required for the broth microdilution. It's probably RPMI broth that's used for broth microdilution.
Yeah, I will definitely research this and look it up so I can learn. That's something that I haven't worked before, and it's pretty it's amazing learning about this. But you do the same sources basically, or is there anything else that will physicians request? Or
yeah, generally sterile sites. We try not to do antifungal susceptibility testing on non-sterile sites. So if we did it for non-sterile sites, it would basically be urines from catheterized patients, perhaps in an ICU where it might be significant. That's really the only situation I can think of where we would do it on a non-sterile specimen. Everywhere else, any other isolate is regarded as a colonizer or a contaminant, really. Yeah, so fairly similar.
okay, yeah, we do sometimes. We get a lot of requests and to do other stuff, so it's just you kind of get familiar with the physician, and as you're reporting something, I know this is gonna come back, and
yeah,
because people will kind of just set them up just in case, and when they do that, they end up being right because you do get that request, and you kind of save a day. But as we're talking about IDs and susceptibilities, and I mentioned some places they don't even have the means, and I have worked in labs like that where there wasn't even a yeast card or anything. It's just they will just presumptively identify Candida albicans, and that's it. And then if anything else, it will have to be sent out. So
yeah,
it's always it was definitely different for me, and maybe a little bit shocking because I went from a large facility at one time to a smaller one, and then I went back to the larger one. So just learning how different labs and what things they do.
So that's an interesting point, Luis, because a few years ago when Candida auris emerged in South Africa, we looked at all the laboratories in the country and how people identified yeasts. And there were, in fact, a lot of laboratories that would, from non-sterile specimens especially, either identify Candida albicans, and anything else that wasn't albicans was just regarded as non-albicans Candida. And, from an infection prevention and control perspective, that wasn't helpful because you didn't know whether you were missing Candida auris. This was also before all of the laboratories managed to get Vitex systems in. So now that everyone's got a Vitex system, there is at least the means to be able to identify all yeasts. Whereas before, the older systems, I'm not sure if you had these older systems in your laboratories as well. We used to use the API, oxocolors, and those identification systems, which would have completely missed Candida auris.
I am familiar with the API system, but we only use it for the Enterobacterales. So it was just the API 20E, and that
Mm,
was it. And we used it for a few years, but basically, as soon as we got our molding off, then that
mm,
one completely went away.
yeah.
But yeah, I like that point that you say, even if, most places do have a Vitex. So at the very least, you have the means
Yeah.
to, be able to identify them. So what it takes is doing, your validation and getting your samples, but that's, another conversation, but the potential is there.
Absolutely. Yeah, absolutely, Reese. So, Louise, that actually brings us to the spotlight feature of this episode. And today I've got a riddle for you along the theme of mycology, so not completely off, of course. And my new favorite thing these days is to ask ChatGPT to write the riddles for me, just because I've become quite lazy to do them myself. So I put in a little thing to say, write me a riddle where the answer is so and so, and then it puts together a really nice riddle for me. So you can tell me at the end of this riddle what either the infectious syndrome, or you can tell me what type of mold causes this infection. Are you ready?
Yes, I am. I've never used Chat GPT before, so it's interesting.
Yeah, it's my new favorite little toy, I think. So the mischievous mold that loves your toes, bringing redness, scaling, and unbearable woes. Lab tests can reveal its sneaky presence as scientists examine skin scrapings with diligence. So beware of this foot invading guest. Wearing damp socks, it feels quite blessed. But fear not, with treatment, you'll win the fight. And bid adieu to it with all your might. So, who do you think that is?
Is it Tinia?
Yep.
Oh, wait.
Tinea pedis. So, the
Tinea
one that's
pedis,
on the
yes.
foot is tinea pedis.
Yes.
Commonly caused by the group of dermatophytes, which are a nasty bunch to try and identify in the laboratory, especially phenotypic identification is quite tricky. And
Yes, and yeah, typically when you design, there's a word that designs, it's for the site that where it's happening. So like you said, tinea pedis, foot, then you have cruris,
yes,
capitis.
exactly. Anyway, Louise, do you have any last comments on the microbiology of yeasts that you'd like the listeners to know about?
Just definitely, like I mentioned, when you are working the sculptures and you might be in a place where, especially nowadays with the volumes or mycology, a lot of times, it's especially here in the States, in large facilities, it tends to be more compartmentalized. But you will see this in your regular culture. So even if you don't work with that fungal media a lot and you don't process those cultures, they will definitely be on your blood, your chocolate, and definitely, sometimes, some species of candida, they will grow on your McConkey. So that's something to think about.
Mm.
If you just learn to read cultures, don't assume that because it's on your McConkey, it's a gram negative wrong. That's just something very wrong to do. Always, gram stain. And I have seen cases where, you see something maybe growing on your Mac, they set it up. The instrument will give you an ID because that happens. You have some default IDs when the instrument doesn't know what to do based on the reactions. So here you're going down a very wrong path. So definitely be aware. So know your media and be aware that you will see most of these in your routine cultures.
Yeah. And as you say, go back to the basics. Always start with a gram stain. That often will give you the answer.
Definitely. Yeah. It just, sometimes it becomes harder for people with, with the moldy stuff and things like that. And that's a subject that I definitely talk a lot about because, something as simple as a gram stain being lost is not being done because you have an instrument that
yes
can give you the answer.
Yeah.
But many things can go wrong with that. So just those simple, quote unquote, old school techniques They're very helpful. They'll give you a lot of information,
Mm-hmm.
and they can prevent you from making an error that can potentially, affect your patient.
Absolutely. No, those are great words, Luis. So thank you so much for joining me on Microbe Mail today. And it was so good to have you on the show. And I hope we'll be able to do this again sometime soon.
Well, definitely my pleasure being here. Thank you for inviting me.
It's a pleasure, Luis. So until next time, that's it from me, Vin, your microbe messenger, and Luis.
Yeah, thank you. So hope you enjoyed this episode.
And the rest of the Microbe Mail team. We'll see you again soon with more contagious mail.
And that, my dear audience, it's the end of this episode. I hope you enjoy learning about yeast and cultures. As always, I enjoy sharing this information with you. Once again, credit for this episode goes to the Microbe Mail podcast. It was Vindana's idea. I had a great time, so thank you so much, Vindana, for giving me the opportunity to be in your podcast. And definitely you, the audience, check it out if you haven't already. So with this episode, Season 2 of Let's Talk Micro is wrapped. So I'll be back in August with Season 3. Great content, great guests. The AMR sub-series is going to continue. So thank you for all the support. Thank you for listening for this past 2 years. Thank you for all the guests. Thank you to all the guests for participating in the podcast. I have enjoyed it so much, and I will continue to enjoy it. So Season 2 ends with this episode. We come back in August with Season 3. If you're taking time off in the summer, if you're seeing family, vacation, enjoy. It's always good to stop and recharge your batteries. So continue bringing that passion to what you do. It's so important. We do such great work. So, as always, stay motivated, stay safe, and of course, continue talking micro. See you in August. Bye.